Welcome back to the Hand to Shoulder Solution, giving pain the middle finger. I'm your host, Carl Petito. I'm an occupational therapist and a board-certified hand therapist. I specialize in the rehabilitation of orthopedic conditions that affect the fingertips through the shoulder. Now, I'm really excited to talk to you about the elbow. And the elbow has to allow you to turn palm up and palm down. It has to allow you to reach yourself. It has to allow you to reach objects. The elbow has 3 joints involved in it. So today, let's kind of shift our focus a little bit away from fixing a problem to preventing problems. Preventing problems, optimizing the health, really conditioning yourself so you don't have problems in avoiding things that damage or injure yourself. That's wellness. So that's a proactive approach. Let's take a proactive approach today. Brief introduction to the basic anatomy and the mechanics of the elbow itself. So taking a look at the joints, when you have the shoulder blade lies on the back of the rib cage, then you have the arm and the forearm. And the arm and the forearm is connected by the elbow. So in the elbow, there's 3 joints. You have on the thumb side, you have the radius bone, which connects to the thumb side of the humerus, and that bends around the end of the humerus. Also, watch, this is cuts, and that holds everything tight together. And then you have the tip of your elbow. So the back of the elbow, the tip is the ulna. So the ulna, that doesn't spin. That is quite a hinge on the pinky side of the hand, and that comes up here. So when you touch the tip of your elbow and you follow that bone down, that's on the pinky side of the wrist. Now, let's look at the forearm, because these bones, you have, again, back to the radius on the thumb side, you have the ulna on the little finger side, and when you turn your hand palm up, your radius is now parallel with your ulna. When you turn it palm down, the radius flips over the top of the ulna, and you see the action of the motion at the elbow, and there's motion at the wrist also. This is going to be very key information when we talk about the strengthening. So have an awareness that there are 3 joints inside the elbow. Now, there are nerves which connect to your muscles, and nerves also give a sensation. So anytime you pinch off a nerve, the yellow portion are the nerves. So I want to bring your attention to what's called the ulnar nerve. So on the pinky side, if you feel there's bony knob on the inside part of your elbow, sometimes it's best to start by touching the very tip of your elbow and then come up, and you'll feel the bony knob on the inside. Between those two is a trough. It's a little ditch that you can feel, and it's soft. And that's where the ulnar nerve lives. And the nerve it's larger than what it shows on the model. It's about as wide as a pencil or a pen and thick like a noodle. When you hit your funny bone, you're hitting the nerve. So it's not the bone at all. When you bump that, you get a bzz, you get a zinger down the pinky side, and you're actually hitting the nerve. Now, that's why that we should never rest on the table. We should never rest on the armrest. I talk about this syndrome. It's called cubital tunnel syndrome. I talk about this in other videos. And pressure on the nerve is what causes the numbness and the tingling and the aching. It causes a lot of severe problems. It's very crucial to stay off of that inside part of the elbow. The general rule is to just always, 100% of the time, avoid any leaning, any resting on the inside part of the elbow. Okay, the fingers and the wrist, they are attached at the end of the upper arm bone, the humerus. So on the thumb side, there's a knobby area right here, and that's the anchor point to the muscles that do this, and the muscles that do this, and one muscle that does this. So there has to be an anchor point, because muscles only pull, they don't push. So when the muscles pull, when you activate certain muscles, they'll do certain things, and that's where they're tied in. Now on the inside part of the elbow, you'll feel a bony knob right there, and that's the anchor point to the muscles that do this toward your palm, the muscles that grip, and the muscles, and one muscle that turns it palm down. So here's an interesting thing. So when you're squeezing something really hard, I'm gonna grab this hand grip strengthener, and you're grabbing things, you're holding hammers, you're pounding. When you're squeezing hard, you're using these muscles right in here that are anchored up here. And you're also stabilizing with the opposite side. So when you squeeze, in order for this not to happen, your wrist muscles over here have to contract to keep you straight. So if you have tennis elbow, if you have a lot of pain on the outside part of your elbow, and you're squeezing, you say, well, wait a minute, I'm using these muscles. When I squeeze, that is going to also activate this to keep your wrist straight while you are squeezing. So squeezing is a good exercise to do, whether it be, something like this, or another device which is similar to the other one I just showed you that has springs, but not a ball. A ball is unhealthy for the hand. Everybody wants to squeeze a ball. Our hand is sort of cupped like that, but squeezing a ball is not good for you to do. So squeezing, and if a person has arthritis, I have them do an isometric just to hold, so they're not doing a lot of different repetitions and aggravating the joints. Now, when you squeeze and hold, you're working these muscles and getting yourself conditioned to handle the heavy work, the heavy, other weightlifting, other things that you want to do in your life. But some tension or some tensile stress on the tendons where they connect to the bone, and it makes them thicker and stronger. Now, if you're already having pain, you have to be seen by your healthcare provider, because trying to do conditioning is going to make your whatever condition that is causing your pain, it's going to make it worse more often than not. So again, we're talking about conditioning. We're talking about a proactive wellness approach. Talked about muscles that turn your hand palm up and palm down. A great exercise is to use a hammer, because you can adjust the resistance. So obviously this is less resistance, this is more resistance. When you are squeezing the hammer using those muscles that I just showed you, when you turn it palm up, you're working the muscles, from this position, you're working the muscles that turn it palm up, you're working the muscles that do this, and you're working your grip. When you turn it palm down, you're working the grip, again, the muscles that turn it palm down, and the muscles that do this. The muscles that move your wrist, the ones that bring it up toward your palm are in the palmar surface. The ones that bring your hand up toward the back of your hand are on the side that's in line with the back of your hand. So I'm going to demonstrate a couple of nice wrist exercises to strengthen your wrist and the best positioning, so you avoid injury and you get these muscles nice and strong. And when I bring it up here like that, you can see it work, and they're anchored in, again, to the outside part of that bone on the end of the humerus. That's right there. And by the way, if you touch that, the outside part right here, and that's really tender, chances are you have tennis elbow, and you really should get that looked at. So now, let's go to the dumbbell. So working the muscle, lie your forearm, the palmar surface of your forearm, on your knee, and I like to come up on my toes just a little bit, and then I get the dumbbell, and my arm is at a little bit of a downward angle, and then slowly do some curls. Now, your wrist is oftentimes not going to be purely straight up and down. It might go at a little bit of an angle. If it wants to go at a little bit of an angle, allow it to. So you can go here, and you should use enough weight so that you're pretty tired after the 12th, 15th repetition. 10 to 12 reps typically for endurance and strengthening. For the muscles on the opposite side, it's nice to get on the inside part of your thigh, just above your knee, so you can get here, and then again, you're down at a little bit of an angle, and then you're gonna curl that up like that. And you can see the tendons right here that connect the hand and wrist to the muscle, and then this is anchored in on the inside part of your elbow. So strengthening all of this is great for the elbow. And then also the muscles up here that bend your elbow. Some are connected to the socket of the ball and socket. All right, continuing on with strengthening, from the hammer curl position, you can go straight up like this. I like to get my arm right in here on the inside of my thigh and come up, and that's working brachialis and biceps, okay? So brachialis lives underneath the biceps, and here another nice technique is to maybe start in a hammer position, and then as you turn it palm up, you're working biceps, and then you're also working brachialis. So those slow, steady techniques are very, very good for the muscles that bend your elbow. And the flexors, the ones that bend your elbow, they're called the flexors. They pull things into you, and they save your life. You can pull yourself up and save your life. You bring food into you. Now, shoulders. One of the healthiest things to do for the shoulder, one of the best exercises, and this also works the triceps, is to just push it straight up, and as you push it up, the dumbbell rotates, and that's called Arnold press. Back, and you're really isolating those triceps. And the triceps, the ones that straighten your elbow, I'll show you here on the model, they connect to the tip of the elbow, so when they contract, they straighten your elbow. So that's a brief introduction to some of the considerations of strengthening, why it's important, some of the best exercises. Always listen to your body. If it's sore, let's say you did a lot of work that day and you're just, your muscles are a little bit sore, your joints are a little bit sore, don't do strengthening. Save it for another day after you've recovered for a bit. And a person should strengthen, go to the gym two days a week, 3 days a week. The recovery period is very important. Work different sets of muscles, allow the other sets of muscles that you worked the previous day, allow them to recover, and alternate, rotate your exercises, so you don't wear yourself out. More is not always better. The body is living, sort of like a plant. You don't want to water the plant every single day or all day every day. There has to be a recovery period. Thank you for watching. Thank you for subscribing. Write in some questions, write in some comments, share your experiences. I like questions because, I can really give you some pinpointed, accurate information, and share this information with other people who might be wondering, might be having the same questions as you. Thank you.